So we have about a couple weeks left of session. There is a little-known program that is getting some major headlines recently, and that has to do with provide taxpayer-funded free health care for undocumented immigrants. Now, this program is getting out of control. Can you speak a little bit about what this program is?
Sure. Well, last year, and we raised this concern, last year the Democratic majority and the governor put into place a law that said we were going to provide free health care for undocumented citizens from age 42 on up, that we were going to provide them free health care. At the time, they said they anticipated about 10,000 residents would take advantage of this program. We raised the concern. We said that was going to be a problem. By the beginning of this year, the state said, well, we're wrong. That number is about 52,000. Now, this week, the state came out and said, we're wrong again. That number is now 120,000 undocumenteds are going to be receiving free health care at a cost of over $1 billion. That's money that's not in the budget. That's going to create a significant problem. And so here in Illinois, we are now adding thousands a month as you have unhealthy and sick undocumented citizens from around the country, from frankly around the world, that are coming to Illinois because of the fact we are the only state that covers these individuals for total health care. And so this is something that is really creating a significant problem for our budget.
Let's talk a little bit more about kind of the coverage that they are receiving. It's my understanding that the federal government provides no matching dollars for this program, that it's fully Illinois taxpayer funded. What about the health care that they're receiving? It's my also understanding that it's probably even better than people on Medicaid or citizens on Medicaid who really need coverages. Can you kind of talk about that?
This is an important issue as well, and another frustrating thing. The president opens the borders up, but then he says, but we're not going to pay for any of the health care. This is 100% paid for by state taxpayers. The program of health care that they get is actually better than those of our own residents that are on Medicaid. So our low-income, struggling families in Illinois that are on Medicaid, they do not get as good a services as these non-citizens are getting that are coming into Illinois. So that's costing us significantly more than it costs our own residents. And in addition to the over $1 billion cost of health care, we're also providing free daycare for their children. We're including free housing, food subsidies, cash subsidies. So the total cost of this program is in the billions of dollars, and that means key programs for our developmentally disabled, for our seniors. These people are now being crowded out. Our own citizens' programs are not getting the funding they need because now we are becoming the healthcare provider for every sick individual in the world that can come to Illinois. If this doesn't stop, I can guarantee you this does not end well for Illinois.
And you're a member of the Senate Appropriations, Health and Human Services Committee, and just this week we heard these figures straight from HFS. What's interesting is just in about a month's time, they've even again increased their projection FY24, the next budget year's liabilities for this program. So we're now at about $1.1 billion is what I heard out of that committee. I also heard in that committee another proposal come up just minutes after we talked about the astounding figure that this program is going to cost. What was that proposal, and what would it do to even expand upon that program?
Well, that's what's so frustrating. On one hand, they talk about this program has exploded so big, so much bigger than they ever thought. And yet it wasn't 15 minutes later that the Democrats said that program needs to be expanded. We should expand it even further, it costing even more. That is something that is just so shocking, and we're hoping that we can stop that in the next 2 weeks. But people need to understand, these aren't our numbers. This is all information that's coming from the Pritzker administration. These are their numbers that we're seeing. And if we don't address this now, it's going to be a bigger concern. Compounding this is going to be after May 11th, when Title 42 ends. That's that federal program that when that ends May 11th, the state is saying we could face even a bigger inflow of non-citizens, which means this program can even grow at a faster rate, which again, there is no funding in the budget for it. It means massive tax increases or massive cuts to programs for our own citizens. So we have a significant problem that the governor and the Democratic majority has to, one, take ownership of, and two, has to join us in coming up with the tough decisions that we need to solve this problem.
So some may say, you know, this may be a noble cause, right? These probably individuals have underlying health concerns or health issues that have gone untreated for years, and that it's a very noble cause. But on the flip side of that, the state of Illinois is underfunding several programs that they've already made promises to Illinois citizens. Can you kind of speak about some of those people that are being kind of cut loose in that conversation?
Sure. I mean, from a humanitarian program, these people certainly need help. But they should be getting help from the countries and the states that they're coming from, not Illinois. Stay there, we'll work with them, and as a country that should be solved. It's not Illinois' taxpayers' responsibility to pay for the health care of those coming from other countries. We have enough problems trying to take care of our own citizens. We owe it to our own citizens to help them before we start solving the health problems from people from other countries around the world. And so our job is to work with the priorities of our families and our seniors, our disability community. That should be our focus. And yet, right now, the state's focus is on how can we be the provider of health care to people from around the world. And this must stop, or again, this is going to end very, very poorly for Illinois taxpayers.
It's a very interesting conversation, and I know one that will continue to play out over the next 2 weeks as the budget progresses. So thank you for taking time to speak about this program.
My pleasure. Thank you.